Hello and welcome. Today we're discussing penile lichen sclerosus, a chronic inflammatory skin condition that can significantly impact a man's health and well-being. We'll explore what it is, how it develops, its symptoms, and the available treatment options. Our goal is to provide you with a comprehensive understanding of this condition. The exact cause of penile lichen sclerosus remains unknown, but research suggests a combination of factors may be involved. These include genetic predisposition, as some individuals may inherit genes that make them more susceptible. Autoimmune factors also play a role, where the body's immune system mistakenly attacks healthy skin cells. Additionally, local skin injury or trauma may trigger the condition in susceptible individuals. Hormonal imbalances have also been implicated, but the evidence is still limited. Infections have not been proven as a cause. Penile lichen sclerosus primarily affects the skin of the glands and foreskin. The underlying process involves chronic inflammation, leading to collagen changes in the dermis. This leads to thinning of the epidermis, the outermost layer of skin. These changes result in the characteristic white plaques or patches, hardening of the skin, and potential scarring, potentially leading to phimosis, a tightening of the foreskin that makes retraction difficult or impossible. Over time, untreated lichen sclerosus can distort the normal anatomy of the penis and potentially impact function. Penile lichen sclerosus is not a common condition, but its exact prevalence is difficult to determine as many cases may go undiagnosed or misdiagnosed. It primarily affects uncircumcised males, with a bimodal age distribution more common in pre-pubertal boys and adult men between the ages of 40 and 60. Circumcision in infancy appears to be protective. It's important to remember that while lichen sclerosus can occur in children, its presentation and management may differ from that in adults. Estimates suggest that it impacts a small percentage of the male population. However, the lack of population-based studies limits accurate statistics. The signs and symptoms of penile lichen sclerosus vary, but common manifestations include white, shiny, flat, top patches on the glands and foreskin. These patches can coalesce and thicken over time, forming plaques. The skin may become thin, fragile, and prone to tearing. Other symptoms include itching, pain, burning, discomfort during urination or sexual activity, and in severe cases, difficulty retracting the foreskin of phimosis. Cracks, fissures, and bleeding can also occur. In long-standing cases, the opening of the urethra mitis may narrow. Diagnosis typically involves a physical examination by a healthcare professional. The characteristic appearance of the lesions often provides a strong indication. A skin biopsy is usually performed to confirm the diagnosis and rule out other conditions, such as balanitis xerotica obliterans, which is essentially lichen sclerosus specifically affecting the glands. The biopsy sample is examined under a microscope to look for the telltale histological features of lichen sclerosus, including epidermal thinning, dermal homogenization, and a band like lymphocytic infiltrate. While there are no formal classifications of penile lichen sclerosus based on types, it is often described based on the stage and severity of the disease. Mild cases may involve only small, localized patches with minimal symptoms, while severe cases can present with widespread involvement, significant scarring, phimosis, and functional impairment. Staging based on disease extent is not widely used. Clinical assessment remains the main guide for treatment. The primary goal of treatment is to relieve symptoms, prevent disease progression, and improve the patient's quality of life. First-line treatment typically involves the use of topical corticosteroids, such as clobetasol propionate. These potent anti-inflammatory medications help to reduce inflammation, itching, and pain. Regular application, as prescribed by a doctor, is crucial. For phimosis, circumcision is often recommended. Other treatments may include topical calcineurin inhibitors like tacrolimus or pimecrolimus, which can be used as an alternative if corticosteroids are ineffective or poorly tolerated. Regular self-examination and follow-up with a healthcare provider are essential to monitor for recurrence or progression of the disease. It is important to emphasize that treatment rarely cures the condition but manages symptoms and prevents progression. Currently, there are no proven methods to prevent penile lichen sclerosus, given the unknown causes. However, some measures may help reduce the risk. For instance, good hygiene practices can help prevent irritation and infection in the genital area. Prompt treatment of any underlying skin conditions can also be beneficial. Individuals with a family history of autoimmune diseases or lichen sclerosus should be particularly vigilant and seek medical attention if they develop any concerning symptoms. Circumcision in infancy may also lower the risk of developing this condition in men. The prognosis for penile lichen sclerosus varies depending on the severity of the condition and the individual's response to treatment. With early diagnosis and appropriate management, many men can achieve significant symptom relief and prevent long-term complications. However, recurrence is common, even with treatment, so ongoing monitoring is necessary. In severe, untreated cases, lichen sclerosus can lead to significant scarring, phimosis, urethral stricture, and even an increased risk of penile cancer, although this is rare. Recent research is focusing on understanding the underlying mechanisms of the disease to develop more effective, targeted therapies. Some studies are exploring the potential of immunomodulatory agents to better control the autoimmune component of the condition. Researchers are also investigating non-invasive diagnostic techniques to improve early detection and monitoring. The importance of long-term follow-up for people with lichen sclerosus to detect potential malignancies is gaining increased attention.